All right, guys. I want to thank you guys for joining us. For those who don't know, my name is Kahami Pinard. I am a board certified psychiatric nurse practitioner, and I have a branding company which promotes the wellness and treatment of those with mental health issues. The goal of awareness is basically to destigmatize mental health within the Black community. And I plan on doing so by either doing events with you guys or bringing you interviews such as the one I'm going to show you tonight, and answering questions that may help you get a better awareness of what mental health actually is. So with me tonight, I have Dr. Monique Scott. I'm going to let her introduce herself, explain what it is that she does, and we'll get into the interview. Hi, good evening.
Hi, thank you for having me.
Not a problem.
All right.
Thanks for joining.
Of course. So I am also a board certified psychiatric nurse practitioner. I also have my doctorate in nursing practice, which is exactly what we hear, DNP, doctor in nursing practice. My passion really is working with minority communities to kind of help bridge the gap with a lot of the stigma. But my passion is people in general. So I'm going to help anyone and everyone who comes to me and who needs the help. I can go far back as I've been a nurse since 2006. I started as an LPN, then became an RN, then I got a bachelor's degree, then I got my master's and went straight for my doctorate, and then I crashed. I was tired. But that's basically what I did. I worked the whole time. I was married. I had babies, all that good stuff. Yeah, I think that's it for now.
So right now, where are you currently working now? Since you've been a nurse for so long, currently, what are you doing?
So I run a private practice in Rockland County. Right now it's a virtual practice, and honestly, it's going to stay a virtual practice due to the pandemic. And it's also was something that I planned to do before the pandemic occurred. I see adolescents, children, elderly, whatever age you are, whatever person you are, I take care of my populations. And I find that minority populations, and not just minority as in color, but maybe transgender, different different categories that we may consider minority, they tend to like to come to my office. So, and this just to say that I make you feel as you should, respected.
That's really good to hear, especially for us who are trying to get more people within the Black community into working on their mental health. So my next question is, what made you go into private practice? Did you not like the environment you were coming from? Did you see a need that you felt like you could fulfill more so in private practice? What exactly was the driving force behind that?
Very, very great question. Like I said, I started as an LPN, so every time I got a position or I moved up, I felt like I wasn't doing enough. Like, if I had this power, I could be able to do this. If I was a MP, I would be able to do this. If I was an RN, so all those things would happen. So what pushed me really is working in residential treatment facilities where the majority of the children are minorities, mostly African Americans in my experience, and I work in several. African Americans and Hispanics. So that's what you see in the residential treatment facilities here. And as much as they try to, and I say they as the team, try to put efforts to help these children heal, because most of them had severe trauma and their families were also had severe trauma, I got frustrated because the system just didn't work the way I felt it needed to. The time that I wanted to spend, sometimes I couldn't. And I tend to want to kind of heal the whole family, and it just didn't work out. And I also didn't agree with a lot of the things that was occurring and rules that were set in place for children of color. And as much as we say that, all these companies that can say they're culturally accepting and informed, I find that there still was a lot of heavy bias within the providers and practitioners and workers. So with that being said, it kind of pushed me to just go on my own. And I figured, hey, why not? I started it really small, was only seeing a handful of people, still working full time. And the more, I don't want to say discouraged, but the more frustrated I got with the system, the more I put into my practice. And eventually I just went full throttle.
The same thing kind of pushed me into getting my NP and just having that final say, because like you said, within the system, it's not that they don't help, they just don't know how to help. our people specifically. Like there's a cultural aspect to it that I feel is lacking, whether it's due to lack of education or just the person not really taking that extra step to really learn about what the cultural background is to this patient. But that's mainly what fueled me going for my master's. I needed to have a final say instead of just listening to what the doctor was saying to do, especially when I didn't agree with it. So I definitely can understand that aspect of just wanting to do more for the people within our community. So what is it that mental health is to you? How would you define it, especially being a person of color?
Mental health really is a state of well-being, emotional well-being, your social well-being, environment. Like the mental piece of us is really, I also include spiritual because it all kind of compasses. So your emotional and social well-being really is, it impacts your life on a daily basis. I become more depressive of the world is falling apart, of my family, if I'm being abused, the environment is not safe, if I don't have a proper home. So when we look at mental health, we're looking at like balance between emotional health, spiritual health, and environmental health. If we don't have those balances, we kind of crash. We're not really productive. We're not our best selves.
Definitely agree. Do you feel there is a difference between Black mental health and, I guess, other races' mental health?
No, because we're looking at emotional, we're looking at environmental and social. Now, when it comes to definition, no. But when it comes to external factors, there are differences, and there are cultural influences. There's external influences. For instance, you go to predominantly, not saying all Black schools are like that, but for those who went to them nice predominantly Black schools, probably in Atlanta, we're in New York, and most predominantly Black schools are not the most safest or fun place to be. And I went to a school where we had metal detectors, where fights would happen every day, where someone light this girl's hair on fire. I'm in middle school. I'm from Mount Vernon, so Davis Middle School and Franklin Middle School, families started fighting, slashing, blood. Like that's what I was raised. That's what I was raised around. Now my household wasn't like that, but that's what I was exposed to. That's an environment that we cannot thrive in. So PTSD is conditioned. So majority of those kids who went into that school will have that hypervigilance and not handle coping well because we're always on edge or always on a defense. So we have some extra layers. And then we talk about racism. We talk about walking to the store, and I can't even walk in the store without you following me, think I'm going to steal something. How many times have I turned around and just stopped stared? Why are you following me, sir? What? So all those things definitely influence us. And then, like I said, the cultural norms. We, during slavery, we were not allowed to be sick. You better work. I don't care if you have diarrhea. You better put on a pamper or whatever they had back then. You're going to work. You're going to pick the cottons. You're going to clean my floors. We were not allowed to be taken care of. We were not allowed to take a rest. We were not treated like human. We were looking as chattel. So with that being said, we don't trust a lot of providers as we do. That's why we go to church, because that was our safe haven. So a lot of things were conditioned. And I don't want to hear no one say this is an American thing. Absolutely untrue. Because slavery happened in all the Caribbean islands. Every single one of them, you lay them out, we had slavery. Every single one, we had the same type of conditioning. The difference is how we were emancipated. But it's still very much in our culture, in our way. And it's not I hate to say it's culture because we were conditioned to be that way, but all that thing, you gotta just push through. I hate using that word, push through.
Yeah.
Gritting and bear. No, I'm not pushing through nothing. How about that? So when my clients come to me and they tell me I've been just trying to push through, and I said, don't push through, girl. Sit down, and let's stop and talk. There's no pushing through. You don't have to. So yes, there are layers to mental health in the Black community.
Well, definitely. So you touched upon what would be my next question is, what are some of the obstacles you feel that we as Black people have to face when either getting treatment for mental health or even just acknowledging that we have a mental health issue to actually focus on? Do you feel like there are other obstacles that we go through?
Of course. If you don't understand my cultural norm, you can start saying that me having dreams or visions of my dead grandmother or grandfather, you may say that I'm psychotic. I'm not psychotic. This is a normal thing, and we're very much in tuned into our earth and our past, you know, our ancestral, I want to say, this is our ancestral norm. We're very big into spirituality and connecting to people. And we always know a lot of us believe in, you know, we always say vibes or discernment for those who are Christians. There's a sixth sense that we can't explain. So when you start talking about that as if which is normal, a doctor may say, okay, this person is delusional. And especially if they have no idea of your culture. So you have to deal with the bias from the provider. And if they don't look at you as their own, if they can't see you and say, could be my family, that's how I say, if you don't see me as a human being, as someone that you can, like, you can't identify that your loved one in me, not saying you need to love me, but if you can't identify that your loved one could be sitting in front of you, this is someone's loved one, then I don't think you can treat me the right way. You may over-medicate. There's a lot of over-medication, especially antipsychotics, is either over-diagnosis of bipolar disorder or under-diagnosis of bipolar disorder. And then a lot of over-diagnosis of psychotic disorders. That's not psychotic. Not much people came to me like, oh, I'm bipolar. So I went over every single symptom. Have you ever had this? No. You're not bipolar. That's trauma. It's called complex trauma that you had since you were a child.
So my next question would be, do you feel representation matters in the field, and why does it matter for us to look the way our patients look like?
Because there is this comfort. Sometimes, and I want to speak for the whole, because you got those select few that say, oh, I feel comfortable from everyone. Go ahead, feel comfortable from everyone. But the reality is, I've had my life experiences, and I know when I sit in front of someone, they already have it in their mind who I am, what I deserve, before they even sit down and really listen to me. And representation matters, because if you have someone who looks like you, who understands what it's like to be in the skin, you already have a layer that you don't have to explain. I've had a lot of patients, international students, not just Black, but Muslims, different Asian countries, patients who they'll say, like, I went to the provider, they didn't understand, or I spent most of my time in therapy explaining my culture before I can get to the depth, and I'm tired of it. I've had that experience, and it's facts. So representation absolutely matters. And also, when we have these, when we have like our clinical meetings and we come together to talk and discuss complex cases, you want to have a person of color within that group who can possibly give you a different look or a different aspect of what you may thought or think the problem is. You need to have diversity. You need to have people of color. You need to have Asians. You need to have different people representing the world, which is the United States, because we have basically every country in this country.
Okay, so now that you mentioned being back in the facilities and where you work and how important it is to have providers from different backgrounds be represented, can you explain to me, or have you ever had a chance or a time where being a provider of color helped you or hurt you?
I mean, working in a facility where a majority of the patients are Black, that's a help. A lot of the times when the parents see me or they interact, they're happy that I'm a person of color. And then they feel they can talk about a lot of things that they may not feel comfortable talking about with my white colleagues who mean well, and especially my old job, a lot of them are very culturally educated and engaged and understood. Like all these talks that we're having now because of Black Lives Matter, they've been doing that. But it's still nice you feel at home, you feel safe. So just being someone of color, I think that helped. And then when there was complex cases or difficult cases where someone's being too irate or being too aggressive, a parent more so, that didn't scare me. Now, sometimes people will look to you like, hey, you need to save the day because we can't do this. And sometimes I'm like, no, you need to save the day and utilize your skills. But that, me being around the environment that I'm around and all that stuff, I'm kids carrying on, huffing and puffing and threatening. I'm like, boy, sit down. What you gonna do? Okay, when you finish doing, you let me know. I'm good. What you say you gonna cut me? Okay, cut me. And they'll just look, because they get that, they know that familiarity, you know how we go, how we have our code switch. And a lot of times that is a plus for me to get a connection with the kids, and I should say with the adults, because I did take care of adults there too, but also with the families. And the majority of my coworkers, especially like the direct care workers, were people of color. To me, that's an extension. That's a family. They understand. So people of color were taking care of children of color.
Do you feel from then to now that Black people are more ready to embrace mental health?
I think they're coming around now, and I only because it's being spoken about a little bit more. Celebrities are being more aware. I mean, it's happy celebrities have bipolar and schizophrenia and all that stuff, so they just be out there.
Mm-hmm.
And then, like I said, people are more comfortable about it. I've had patients say, hey, it's actually my friend who told me I should look into it, or my family actually encouraged me to do it. They knew something was wrong. So the fact that families are being more supportive, they're more open to trying it. So I think we are ready. I think, is there enough providers for us? I think no.
I definitely don't feel like there's enough providers, because just as you've had patients that come to you and they smile, I've had patients at my per diem, like older women. I think I'll never forget, it was one woman, she was maybe 75, close to 80. And she just kept smiling at me. And she was like, I never thought I would see someone that looks like me in your position. Like I actually cried in front of her, which I try not to do with any of my patients. But just hearing her say that, and the fact that she told me about how long or how many providers that she's gone through. And I hear it from other patients, just trying to find someone that they can relate to. There really isn't enough of us. But I feel that because mental health was so shunned within the Black community for so long. It was either, oh, you know him, that's Uncle so-and-so, or don't bother him, just leave him to himself, or yeah, you know, he wilds out every once in a while. Like there was always an excuse for a person's behavior and how they react.
And then we weren't treated properly. Like, cause you know, when I'm hearing this conversation, I'm also listening to a lot of patients and friends and colleagues who are like, well, I'm Italian. You know, we had that same mindset. We didn't talk about it. Or I'm this. The main thing is that we were Black. So in America, Blacks got the worst ethical treatment when it came to research that we didn't approve of. I mean, the worst treatment ever. So we have that, and then we're supposed to go to a doctor who basically would do research on us without explanation or without permission. So it's a layer that's different. So I want to make sure I say that, because you'll hear those same stories. Old Italian, Irish, all those older generations say, yeah, because I come from this background and they have this, you know, there's a stigma. My parents didn't talk about it. We had a cousin who was crazy. We have that familiarity, but we don't have the same thing when you're in America and you're looked at as less than.
Is there a difference? I know you did your dissertation, I believe for your DNP, you were saying specifically on, if I mess it up, please correct me, Black women and depression? Black women and depression? Okay. So can you tell me more about that? And then also answer the question, do you feel there's a difference between Black men's mental health and Black women's mental health, and how we approach it as providers or how we should look at it?
Okay, so my DMP, I chose this because it was near and dear to me. So I wanted to focus on depression literacy, because one of the things I know is that people have this idea of depression, that you're suicidal, you look all crazy, you look like they have this warped idea. They don't think they can walk around depressed, when most Black women walk around and live depressed for decades. So I wanted to increase depression literacy and decrease depression stigma. And I used validated scales that I got permission from a psychologist in Australia. So what I did was I utilized a community center, because we love community. Let's face it. We love to be with our sis and our brothers. We love to poly and eat. We love our barbecues. It's just a thing. It's innate. We can't help it. It's not only, you can't even say it's Black, it's just in our DNA. Because if you go back to Africa, that is just what you're going to see all over that continent. So I decided, let me find some place that doesn't feel sterile. Let me find some place that doesn't, you know, you don't feel like you're being watched. So I chose a community center in Mount Vernon, the Dole Center, because everyone knows the Dole Center in Mount Vernon. That's where we had every single event that you could have, birthday parties, someone got shot there. I mean, girl, it done been all. So, I mean, and then really, really amazing things have been done there. So I decided to use that, and got some participants, all women of color. And, you know, Mount Vernon is small, so you probably, I knew just about everyone. And we went into a conversation. So I made it feel like a conversation versus a lecture. I incorporated information from the past. I incorporated a little bit more history, not just Tuskegee, but other events that occurred in medicine that has influenced our reasoning or our deterrence from seeking medical treatment as we should or as we could have. And then we started tying in depression education. And once I did that, we really sparked a lot of dialogue. They shared information about, oh my gosh, I think my family member has been living with this for, 15 years. I didn't know that it was this deep. I thought that, you had to be suicidal or whatever. So we went over symptoms, what it looks like, where we stand as women, and why do we look at it differently. And that's pretty much what it was. So depression literacy, there was clinical significance, but the statistical significance wasn't strong enough because it was a pilot project and it didn't have a large enough group. But it's definitely something that should be expanded. And I would love to probably, make it even larger than it is, an organization, make sure that we do something maybe once a month. It's all about making it, normalizing it. You normalize it by gathering people and giving them some food, a little drink, a little, make it casual, and it becomes casual. So with that being said, the reason why I felt women were important, because we are the monarchs of families in our households. As much as you may have, especially the old school, you have the men, they do the strength, they this, we run it. Okay, let's just be real. The CEOs, we carry the babies, we make sure we're running all of it. So women are the caretakers, right? Yeah. I figured go to the caretaker so she can learn about herself, take care of herself, and see the signs in her entire family, her husband, her daughter, her son, her mom, her aunt. And depression is different for men and women. So we go back to the question. The way you approach a man and a woman, to me, should be the same as far as being, having empathy, listening, stop assuming, and put no pressure, no bias within that session. If a big old strong muscle black man who looked like he could break you in half sit in front of you and start boo-hooing, let him boo-hoo and let him know it's okay. I think I have men apologize. Don't you dare apologize. Don't you dare cry. Matter of fact, let me get you some paper. You need some tissue. Cry some more. Let them feel that this is okay, because it is. So societal norms actually can cause a lot of difference in how women and men express their needs, or how depressed they are, because of the standards that we have on men. A lot of men are quick to accomplish and complete a suicide. They have more completions. Women have more attempts. Women hormonally, let's face it, we're born, then puberty, then pregnancies, then premenopause and menopause. So this is us. This is our hormones. We're like this every month, and then this and that. We just all over the place. So hormones do influence our moods and how neurotransmitters are I guess how neurotransmitters transmit basically. And then men, let's talk. You're born, you have puberty. This is it. And then you start slowing down a little bit. We don't have it like that. So if you want to look at those dynamics and societal norms where all the pressure on women to take care of the kids, cook, clean, this, that, all those stressors, and then push through. And then, that's where the Black woman schema came about. You do some research, you find that some research created that. Where Black women think they're supposed to push through it. We think we're just supposed to be conditioned to keep on moving, and we're not supposed to show our fear or show weakness.
I definitely have had, for me, as when I first became a provider, having grown men cry in my office was actually very weird to me, because like you said, we've grown up, men are strong, women are the ones that cry, they'll break down, but they've held it in for so long at that point. These were men 40s, 50s that were actually coming into my office and breaking down, but eventually that cap kind of blows off and you have nowhere else to go. and it's sexual trauma, and it's physical abuse, and it's abandonment, and it's substance abuse. And it's just so much that they've just kept under the rug because they can't show emotion, and it's just not fair.
It's not fair. It's painful. It's really, really discouraging to hear that. So that's why we need to educate men that this is okay. And then the women, you're putting the pressure on men to be inhuman.
We kind of do.
Yeah, you want them to be solid rock. You want them to read your mind. You want them to buy you a whole house. You want them to perform every night in bed. You want them to cook? You want them to, can they cry? Can they cry a little bit? We put too much pressure on each other. We need to be empathetic and caring toward each other and understand that we're human, not that you're a man and you're this and you're a woman. You're human. You feel, you hurt, you bleed. So we need to be more caring.
What do you feel needs to change in terms of Black mental health or Black people in dealing with their mental health, community-wise, on a family level?
Community-wise, well, I can tell you one thing. I have not, when doing my DNP, it was very hard to find a lot of articles written by Black nurse practitioners. First of all, written by Psych MPs, period. But there was very few, if not any, I can find of Black MPs publishing research and articles that can be very useful for our community. So we need to see more of that on a professional level. We need to encourage more people of color to become nurses or psychiatrists, whatever, in mental health or therapists. We need more of them. And there's no pamphlets or there's not enough or barely any type of advertisement or marketing tool to target African Americans. When I did my research, because I wanted to use stuff that was already out there, there really wasn't. Mind you, I found telenovelas, which was like a Spanish version of mental health education, and it used their lingo, their twang, everything, their people, made them comfortable, and it worked, because I've got a lot of articles, and it was a huge, I just remind me, it was a huge research that was supposed to be done and published, and I spoke to the researcher when she created even more. She used the telenovelas and a couple other things that was culturally sensitive care. And as far as like on a community level, like the idea that pilot project, that needs to happen in every way. We need to incorporate, like when we have all these BET awards and whatever it is that we do, even like the curl fest, which I love. I haven't been to any of them yet, but I think when we have those type of events, we need to incorporate mental health in somewhere in it. We need to squeeze it in there. Not squeeze it. We need to actually highlight it. Yeah. So it's a norm. We need to broadcast it. It needs to be on your sleeve. You go to therapy, talk about it. Okay, I go to therapy. Mm-hmm. Talk about it. And then as far as family, when it comes to therapy, especially when it's of a child, I feel that if the parents are not in therapy, then it's good as nothing. So if we're looking at family dynamics, if we're going to care for the child, we have to care for the whole family. The family must be committed and have to be in therapy. There has to be a change, and the change cannot be just with the child. The child has no power. So that's another thing. And to be more open, families need to be more open, parents need to be more open and more aware. Talk to their kids more about bullying. Talk to them about mental health. Have the conversation. If you never had it, then you may need to sit down in front of the therapist so you can figure out how that works.
Mm-hmm. So yeah, I definitely agree with you in terms of on the family level that everybody has to be included, whether it's a child or maybe adolescent, young adult. But because I currently am I actually stopped treatment because it wasn't effective and I didn't feel I was doing the patient a service, but his mom has her own mental health issues that is not being addressed. So she consistently calls 911 on this kid and will say, oh, he's trying to hurt himself, he's suicidal, and the kid gets picked up every single time. So we get somewhere in terms of progress, medication, therapy, and then he gets dragged into hospital because mom's issues. And it's like,
the damage, reoccurring damage, and that is a very difficult, very, very difficult to address when there is like that type of upheaval in the home. So, and I mean, even it could be as simple as teaching the parent how to deal with a kid who is in a panic. Yeah. They panic, then they don't know what to do. And it's just like, more meds, do this. We have to make sure families are really involved and really engaged and learn how to win them over and not insult them, because that happens a lot. Plenty of families have said to me, I'm tired of a white person coming in my home and telling me what I'm doing wrong and taking my kids out of my home. Because they've said it before. And they've even said it out loud directly to colleagues because they've been traumatized in the past.
I could imagine, but having a white person or someone from a different race come and tell you you're doing something wrong as a parent, especially for those who were trying and it was something completely out of their hands that happened. Like,
or they just don't understand the cultural norms or the dynamics, and it comes off like we're already scrutinized in society. Then you have someone else come into your home, and that is very invasive. I don't think people realize how invasive that is. You come into what I consider my safe space, and you're telling me I'm wrong, like I'm doing something wrong, my kids are wrong. It's really, really, it causes distrust, and it causes treatment to be prolonged.
Oh, I don't have any more questions. Did you have any comments or any statements that you wanted to make, or questions for me that you wanted to ask before we wrap up?
The only thing I want to say is that we just need to take more time to really seek counsel, seek a therapist, a counselor. I'm not saying you can't go to your pastor, but there's certain things that your pastor won't have a level of. There's a level of science that is needed to be able to help you through some things. And not everyone can do that. And pastors need to be more aware and have a little, be humble. Know that there's certain things you cannot do, and refer them to more therapists. Start connecting to Christian therapists if needed in the home, in churches. We need to make this more, we need to normalize it. We need to be okay. We need to heal, because we still deal with a lot of microaggression. We still being traumatized to this day. Like, who wants to see someone get killed on TV by someone kneel on their neck, and we're watching it over and over and over, and all the race relations and conversations start happening? That's traumatizing. Yeah. It's I call it micro trauma. It's traumatizing. So we need to start healing. We need to start healing as a people. We need to start healing as a culture. We need to start healing as a community. And it only starts with seeking help. And just remember, every therapist is not created equal, meaning it's like you got to find the right fit. So if it didn't work the first time, find out why you think it didn't work, and then look for someone who you think will work. And stick it out a couple of sessions before you see you don't like them.
Very true. It's like, I guess, finding someone to date or be in a relationship with. Just because the first one or two didn't work, you're not just going to stop. Like,
exactly.
It's kind of the same thing, because you have to kind of build that rapport, that relationship with the person before you go deep into it. And I think that's another thing that we deal with as Black people, finally finding a therapist, or even getting into the field of mental health to finally take care of yourself, but then having to find someone that works. And then the person leaves, and you kind of have to start that process over again. So that's another obstacle that I've seen for my patients in terms of therapy.
That happens a lot.
Yeah.
That does happen a lot. What's the next thing what's the next event for awareness?
For awareness, my next event is August 22nd. It's Caribbean culture's effect on our mental health. So I'm going to be talking about stereotypes that we grew up with, hearing from our parents, the fact that they never apologize, certain things that we just grew up on that affected how we deal with our own mental health, our own self-care.
Yes.
We don't even
and
realize.
That we have high anxiety. There was an article that I had read 10 years ago. It was a while ago, and they talked about people who were raised with very strict upbringing. They mentioned Caribbean cultures had very high anxiety. So trust me, that's going to be a good conversation.
Yes, I definitely can't wait to have it. Tickets are on sale now. I'm still promoting, but it's a conversation. We need to start somewhere, and I feel like finding just the root of where certain things that we do now, where that comes from, why we do it, that's just the start of what we can do to start the healing process.
And pray that we do better with our kids.
Oh, yes. That's the whole point of trying to heal now. Some of my friends, for those who do have kids, hopefully they're young enough that we can learn how to program or reprogram ourselves so it doesn't affect them. Like, we break whatever curses.
Break the curses, change the cycles, change the way we talk. It took me some time. Who I am now is not who I was when I was 20. And I had a baby at 15. So the way I raised my oldest is completely, it's not so different, but there's definitely softer nuances to how I parent now. And it's all about learning and educating.
Well, thank you so much, Dr. Scott, for being here and joining awareness and shedding some type of light on Black mental health and what it is we need to focus on, how we can heal, and what we can do better as a community. I hope you'll join us again if I ever need. Hopefully I'll see you at one of the awareness events upcoming, but most definitely thank you.
Thank you for having me anytime.
Thanks.